If you are considering the abortion pill to end your pregnancy, you deserve to be fully informed about how that procedure may impact your body and your life. So here are some vital facts. The abortion pill is the only FDA-approved non-surgical abortion procedure for use in early pregnancy. Many women are initially interested in this method because they want to avoid a surgical procedure, and they think it is as simple as taking a pill.
The reality is that terminating a pregnancy by any method is not simple and can affect your life for years to come, and that includes the abortion pill.
So what do you need to know? First, the abortion pill is not like other medications. It is not available by prescription, but is only dispensed during a visit with an authorized provider.
On that visit, the abortion provider usually does an ultrasound to date your pregnancy to see if you are eligible for this method.
The Food and Drug Administration has approved this procedure for pregnancies up to 70 days from a woman's last menstrual period.
Next, you sign a patient agreement form that says you have received a full explanation of the risks and what to do should you experience complications.
While it is called the abortion pill, it is actually two medications that cause the termination of pregnancy. They both start with the letter M, so it can be confusing.
First, the abortion provider gives you mifepristone to swallow. This drug blocks the hormone progesterone, which is needed to keep the pregnancy growing. The embryo usually dies over the next few days.
1 to 2 days after taking the first pill, you take the second drug, which is another M word, misoprostol. It causes cramping and bleeding that expels the embryo. If you are home alone, make sure someone knows what you are going through so they can check in on you. The majority of women abort within 24 hours after taking the second drug.
If your pregnancy is beyond 8 weeks from your last menstrual period, also called LMP, you should know that you may see identifiable parts expelled. By 10 weeks LMP, the developing baby is over 1 inch in length and has easily recognizable arms, legs, hands, and feet.
Although we know that pregnancy loss can be deeply painful, little information is known about how seeing body parts expelled from your body could impact a woman's mental health. You may wonder what side effects a woman may experience after taking the abortion pill. Typically, they include abdominal pain, severe cramping, nausea, vomiting, diarrhea, headaches, dizziness, fever, and chills.
So we've talked about the different drugs involved, the procedure itself, and some of the side effects. While severe complications are unusual, they do occur. So next, let's discuss what can go wrong.
On average, women bleed about 9 to 16 days. This is to be expected. But about 1 woman out of 100 bleeds so heavily that she needs a surgical scraping called a D&C to stop the hemorrhage. That can be real frightening if it happens to you.
Women are surprised to learn that the abortion pill is not 100% effective, and sometimes the pregnancy continues to grow or is only partially expelled. So how likely is this to happen? Well, the further along you are, the more likely it is.
For example, at 10 weeks LMP, approximately 7 out of 100 women will still be pregnant after taking all the pills. What do you do now? Well, usually a surgical abortion is done to complete a failed or incomplete medical abortion.
So a woman taking medication to abort non-surgically may still end up going through surgery. She would also have the option of continuing her pregnancy.
If a medical abortion is unsuccessful and the baby is carried to term, there is a higher risk of birth defects. It's also very important to know that the abortion pill won't end an ectopic pregnancy. This happens when the embryo attaches outside the uterus, usually in the fallopian tube. If this condition is not treated early, there is a risk of the tube bursting, internal bleeding, and sometimes even maternal death.
The FDA places warnings on certain prescription drugs to call attention to serious or life-threatening risks. Because some women have experienced severe complications, including death, after taking the abortion pill, the FDA has issued labeling warnings and restricts availability to ensure that the patient receives all the risk information and to reduce life-threatening complications.
The FDA also advises women to see a doctor immediately if they experience persistent fever, severe stomach pain, heavy bleeding, fainting, or feeling weak.
These symptoms could signify a life-threatening complication. But what's difficult is that many of these symptoms are the same as the expected side effects. This can make it hard for a woman to know if she is having complications that require medical attention or not. However, when in doubt, she should see a doctor immediately.
The FDA also warns against buying abortion drugs over the internet. That's because these drugs are not subject to the FDA approval process and safety regulations. It's risky to get a medication from suppliers that offer to send you abortion pills without you seeing a licensed medical professional.
What else should you know? First, remember that there are 2 drugs involved in the abortion pill method, and that in some cases the medications do not end the pregnancy.
Second, it's important for you to know that after the abortion pill became available in the U.S., cases began popping up where women regretted their decision after taking just the first drug and were desperate to stop the abortion. In response to this need, some physicians began using natural progesterone to reverse the abortion and rescue pregnancies exposed to the abortion pill.
Research has shown that the majority of women who received the progesterone treatment went on to deliver healthy babies. This procedure is known as the abortion pill reversal.
Finally, anytime a living baby is aborted, the woman undergoing the procedure and those participating in it can be affected emotionally, mentally, and spiritually.
As a medical professional, I want to bring healing and comfort to my patients. One way I do that is by sharing my medical knowledge so patients can be well informed. I've met many women who wish they had known all the facts before making a life-changing decision.
Now that you understand more about how abortion drugs work, I encourage you to discuss this decision with your partner or another trusted person in your life.
Also, the people at your local pregnancy center are available to listen and help you as well.